emotional development. Our mission statement is that we want to adjust the healthcare system to focus on one's mind and body and relationships, and we can do this by integrating family centered care, emotional safety practices, and evidence based treatments such as SSRIs therapy and resilience training. Our goal is to help people that struggle with addiction, social anxiety, neurodiverse communication differences, and more. We'll focus on compassion, connection, and education to help build a better healthcare system that fosters personal growth, emotional healing, and social development.
Okay, Eric Erickson's Psychosocial Stages emphasizes the different stages of life and the internal conflicts during each period of development.
We chose Erickson because his theories have a social and emotional outlook on the human condition, and that's something that we wanted to include into our healthcare system to help improve it, not only for the patients, but also for the staff. These ideas can help the staff by with us creating support groups and bringing attention to issues while listening to their concerns and just giving an overall emotional support. And we can use these ideas to help their patients by listening to their issues and being inclusive.
We want to promote emotional safety and support for all. Emotional safety is just as important as physical safety, and support groups would be a great way to promote and normalize mental health conversations in several communities, like for addicts, midwives, and healthcare professionals who dealt with traumatic or aggressive encounters in the workplace. By making patients and healthcare workers feel listened to and cared for, we create a safe environment to voice their experiences and be able to express any problems they may be facing.
Community-based healing for addiction. Addiction is impacted by biological, psychological, and social factors that, and all of those add up to the biopsychosocial model of thought, which can be, it's like a way of attributing uh illness to health. So connecting all those dots. Having family as emotional support is essential for treatment retention and long-term recovery. Including family and healing processes for addicts enables the patient to progress in treatment through attacking issues and working on relationships that are essential to patients' mental health. The proven treatment methods for addiction. The first method is multidimensional family therapy. This treatment model aims to resolve issues in parent-child relationships through sessions with both parties by focusing on individual, family, parents, and extra familial factors that affect the patient. The multisystemic family therapy model. This treatment is for adolescents who face substance abuse or other serious delinquency issues. It focuses on the interpersonal environments and systems that influence behavior, trying to attack the source of the issues rather than only focusing on the patient. It focuses on the relationship between the parent and child, labeling the relationship as a circle. This model compartmentalizes any stressor or issue and attributes it around the circle as reasons for the conflict. Family involved treatment for addiction or the CRAFT model. The community reinforcement approach and family training model, otherwise known as the CRAFT model, is a family involved model of treatment for adult substance abusers. Unlike the aforementioned models, in this model, the family member is expected to learn how to change in order to support the family member that is struggling with addiction. Family therapists are utilized in this model to identify triggers and set boundaries, making relationships heal as they begin on the journey of regaining trust.
Okay, so some things that we can do to enhance social emotional understanding across neurodiversity is educating healthcare providers about the different ways patients can process information so they don't rush through explanations or instruction and take their time allowing for extra questions or comparisons. They can confirm consent, which is important when discussing procedures and treatment plans. So finding different ways to elaborate on information is an important factor to make sure that the patient or other party completely understands what they're agreeing to. And then we can ensure um, understanding with the patients. So restating information or elaborating as needed is helpful to keep in mind, as well as providing other methods of explaining concepts, like with the use of visual aids.
Some treatment ideas for social anxiety are using SSRIs. Social anxiety is when someone has persistent anxiety in social situations due to the fear of being perceived negatively. And some studies done have shown that using selective serotonin reuptake inhibitors, also known as SSRIs, can be used to help people. One study specifically done by the Canadian Medical Association, which showed that the use of SSRIs helped improve social anxiety symptoms. It caused an increase in agreeable behavior and a decrease in quarrelsome behaviors.
Some treatment methods for social anxiety and addiction. The CBT, which is cognitive behavior therapy, identifying the triggers and challenging negative thoughts. It helps the person gradually face fear situations through exposure therapy. Dual diagnosis, integrated treatment, a therapist or team treating both conditions and coordinating the medication and therapy together. How healthcare roles support/depend on social emotional skills. Healthcare roles aren't just about diagnosing, treating disease. They demand emotional labor, social support, empathy, communication, and psychological awareness. The social emotional learning was originally developed for educational settings, but now it is more discussed within the medical and nursing education. Embedding social/emotional development into healthcare roles help build sustain compassion, patient-centered care that are better for patients, providers, and for system. Emotional intelligence, healthcare practitioners with higher ER are better at perceiving, understanding, and regulating emotion. This also helps them manage stress, stay resilient, and maintain professional performance under pressure.
How support groups help mental health. Do midwife support circles promote mental health and well-being? Is the question being asked in this particular piece of research. Many student midwives have reported feeling good and heard after being a part of a support group. The research provides multiple examples of how support groups can help other careers and people feel supported mentally and physically. Support groups help people both socially and emotionally. By being around others who experience similar trauma and talking about it, it helps people in the mental aspect of trying to hold everything in. People connect socially by talking about it with others. Support groups in the workplace should be promoted more because they help people tremendously. In our mission statement, we mentioned trying to help people that struggle with certain things. For example, social anxiety and addiction. Certain groups can help a lot with that. Support groups can help a lot with that. Social anxiety is proven to lessen after a support group session because during the session, all you're doing is talking and listening to each other. Talking out loud to others helps reduce social anxiety. Support groups help make our mission statement stronger. Support groups have proven to be beneficial in the healthcare field. Student midwives have talked positively about student support groups. I'm so sorry, guys. Saying it helped them get their trauma out and connect with people socially and emotionally. Support groups should be put in more places like schools and hospitals.
Physical and emotional safety of health workers. So there are dangers in healthcare facilities which have been shown to have short-term emotional effects, but also long-term effects in the workplace and environmental factors and on the nurse themselves. If a psychiatric nurse is working from a place of fear or protection because of trauma, it can affect their ability to connect with patients and provide care from a place of empathy. Exposure to aggression can strongly affect nurses' work in the future and also their mental health.
Learning culture and connection in healthcare, engaging in ongoing education and support for healthcare workers, learning about new studies like new uses for drugs like SSRIs. Do this with interactive tools, workshops, discussions, and digital activities. Our goal is to strengthen understanding and empathy within the healthcare communities. In conclusion, adding these practices to a healthcare setting will not only make patients feel more heard and understood, but also make the staff feel safer and more comfortable at work, which will allow them to provide better care overall. Further considerations. These changes will take time to implement and does not happen overnight. Additional training may need to be implemented to make these changes possible. Healthcare workers need to feel secure to do their job to the best of their ability. Just like students need to feel safe and supported to learn effectively, healthcare workers need to feel safe and emotionally grounded to perform well. Some of these ideas are still experimental and may not be 100%, but there have been studies done on all of these ideas. That is our works cited, and thank you so much for listening to our presentation and watching.